Hi, is everyone back
There's a
from the
cardboard
coffee
box.
break? What I wanted to mention is the next meeting we're going to have is going to be a real roof raiser. We're going to have some workshops. We're going to have a workshop on the making and the rationale behind autogenous vaccines. Now, I think that's one of the things that they like to keep quiet. They don't like professionals talking about it. And the people that most can use that information, of course, are dentists and physicians in the dental area. So, our next meeting, which we haven't confirmed the day up yet, but you'll all be notified. We're going to have that kind of a workshop. We're going to have a workshop on cavitation using pig jaws and electrosurgical instruments to show you actually how to do this stuff. And we're also going to demonstrate the effectiveness of the Cavitat machine, developed by Bob Jones. So we hope that you all can make it. I don't have an exact day yet, but I'll let you know on that. It'll probably be in July or August. We don't want to have it too far away from this meeting, in time-wise. Are we ready? Who's?
Yes, I'm ready. So I'm going to finish with a few things before Ara comes on. Just want to show you a few overheads, some of the things I mentioned before. And then we do a tiny bit of neurology. This is a stool test, a chlorella challenge with stool, in the stool. And we see that this person mobilized 4,009. Now, these are the values, the micrograms of what was in a kilogram of stool. This was just with 6 capsules of chlorella. The aluminum, 4,900 micrograms, is a high amount of aluminum. Now, usually we get about 1,000 micrograms on a normal stool as a reference value in our people. Lead is usually 0, so it was 70 micrograms. And this is mercury, was 51 micrograms in a kilogram of stool, just with 6 capsules of chlorella, a one-time challenge. Yeah, and those of you who've done the MPS challenges, you know how happy you are if you get 51 micrograms of mercury out in the urine, and with a with $100 shot, and here is like 50 cents of chlorella capsules doing the same things, but looking in a different compartment of the body. So don't underestimate. And this other one is tin here, and tin again is a very major player in a lot of neurotoxicity. I see it a lot in diabetes. I personally believe that a lot of adult onset diabetes is tin toxicity in the pancreas, because in those people, when you do DMPS challenges, they, after the 3rd or 4th shot, they get extraordinary amounts of tin out. A few things about dental crowns. This is from Hans Lechner. Hans Lechner is a good friend of us. He's the leading alternative dentist in Germany. This is about fields, electromagnetic fields, and just a quick introduction. So if you have a group of trees, you have a measurable electromagnetic field around, generated by the electrical events in the stems and leaves and branches of the tree. And this is, in short, like a metal crown. A metal crown is a ring structure, even though it's sealed on the top, but still behaves a little bit like a coil, creating fields. This is from a physics lab in Munich. They did some studies on just metal crowns. And so metal crowns set up electromagnetic fields near the field lines. It looks like that when you measure this thing. And when you have a crown, let's say in an upper molar, let's look at that. So this is the crown here. These are the electromagnetic fields generated by the crowns. And here's the structures in the brain. And representative here is like the hypothalamus, and here's the thalamus. And you see that these areas are drenched in electromagnetic phenomena caused by the metal crown in the upper tooth. This is not talking metal sensitivity or allergy or toxicity. This is just talking the fact that there's a metal in the mouth.
There's an error in that hypothalamus is in the wrong place.
Yeah, it may be. I'm kind of disoriented on this
right
chart.
there.
Well, there's actually an
Where the
arrow.
thalamus is.
Okay, yeah, here's the thalamus,
there.
and it should be
That's where the
in here
hypothalamus
somewhere. Yeah. But you know the. Yeah, the I mean, all this is here like to explain like the principle.
I know where it is.
Yeah, the principle that the brain is affected by the metal in the mouth by phenomena other than toxicity or electrogalvanic currents. There's also electromagnetic fields, and the brain cells, if they would communicate with electrical currents, to think your way from here to the bathroom would take you longer than a lifetime. The brain cells communicate with each other with fields that travel at the speed of light. And this is an electric field approximately 1 million times stronger than the fields that the brain cells are using to communicate with each other. That gives you a little bit of an idea by just placing one metal crown in the mouth, what you may be doing to the communication systems in the brain with this one. And here's one of the last things I want to show. Those of you who are into the autonomic nervous system have to look up this guy, Stephen Porges. He talks about the vagus, the parasympathetic nervous system, and the parasympathetic nervous system is emerging as the major player in chronic illness, and the parasympathetic nervous system is directly linked to our emotional system. It's directly under control of the limbic system, and the limbic system is the site where all our childhood stuff, all the emotional trauma from our life is harbored. And Stephen Porges has published a number of papers on the connection of how the vagus really is, the parasympathetic nervous system is the nervous system that expresses emotion on the body. Yeah, all the cranial nerves, the facial nerve, the trigeminal nerve that innervate the musculature here, the motor nerve parts that travel in these nerves actually comes from branches from the brainstem, from the parasympathetic nervous system. All the musculature of swallowing and of voice is all vagus innervated. The muscle of swallowing, voice, all this whole area where we're expressing our feelings is under control of the parasympathetic nervous system. Comes from the nucleus ambiguus in the brainstem, and that's under control of the limbic system. So there's a huge connection between any problems we have in this area and the limbic system. And you can, in my opinion, not long-term get people well with TMJ problems or occlusal problems, problems with repeated dental pain, bone cavitations. Don't forget the vagus. The vagus is the stepchild of medicine that is now only emerging. I just did a Medline search on the autonomic innervation of the teeth, and it is clear since a few years that the teeth are really like autonomic sympathetic ganglia. Inside the tooth you have an ample sympathetic innervation with all the properties of a ganglion. And now the latest is that the vagus is just as present inside the tooth. That means that the teeth have a unique function, that they're both melding points of the sympathetic and parasympathetic nervous system that talk to each other inside the tooth. And in that way you can look at the tooth as an organ from here on, not as a structure like a shoulder bone or an elbow and a tooth, but the tooth you want to look at like the liver and the heart and the tooth in the same vein. The tooth is an alive organ with a full set of nerves. It has a sensory nerve, it has a sympathetic nerve, it has a parasympathetic nerve, it has an immune system, it has a blood supply, it has a venous system, it has a lymphatic system, it has everything that an organ has, and can get ill just like an organ does. And so by keeping that in mind, remember that the parasympathetic nervous system is a direct expression of what's going on in our emotional brain. And I forgot the most important thing I wanted to do. I wanted to advertise my own workshops. Hang on, I forgot that. Would you I always forget to tout my own horn. Would you pass these around and I wanted to point you towards one workshop. There is one healer that has emerged in Germany as to me like probably the greatest healer of this century. His name is Bert Hellinger, who does a therapy called systemic family therapy, and he has dedicated his last couple of years of life of working with cancer and with Holocaust victims. And any one of you here who is Jewish by origin also, I would personally invite you, urge you to come to this workshop. There's so much healing needed if you're Jewish in any kind of way, form, if you're married to a Jewish person, if you're Jewish from your own background, whether you're involved in the Holocaust or not, you're affected by it. And so is the whole nation of the Germans, and there's finally somebody has emerged who is daring to face those issues, bring them up, and do this most incredible healing work with it, that I would urge all of you to come. He is in the 70s. He won't be coming here in the future. It's a one-time chance that you have. It's inexpensive, and I personally kind of extend that invitation. And it's wonderful healing work that you can learn so much from, you can use in your practices. Anyway, so much about the vagus. If you're Jewish, most likely in your memory, in your collective memory, you're hooked up to a very tragic abuse, not only of the last 100 years, but of thousands of years. It's going to be there, and over the vagus, it's going to expressing itself in terms of illness in your own body. And there is a way of healing that by addressing that in very, very wonderful, loving ways in a one-time intervention. So now a little bit about the sympathetics. The last thing I want to say, a little bit of neurology that's very simple, and it's correct, and very, I can't believe that this isn't known by everybody. So when we talk about pain perception, I know there's neuropathic pain, there's nociceptive pain, there's all these different kinds of pain. I talk about nociceptive pain here. When the patient has chronic sciatica, chronic back pain, chronic knee pain, chronic whatever, you have a pain receptor that's stimulated, and the pathway goes to the spinal cord, and in the spinal cord in lamina 2, 6, and 7, you have these wide dynamic range cells, which this information goes through, where the information is modified, then it goes up to the thalamus. From the thalamus, part of the information goes up to the sensory cortex that tells you where the pain is, how it feels, like sharp, dumb, numb, dull, achy, whatever. And the other information goes to the frontal brain that tells you how much you're suffering from it, the emotional component of the pain. And so let's look at the wide dynamic range cell. This cell can either suppress the pain message coming up, which it should do, because these nociceptors, even when you're not injured, they're active all the time. They're sending little electrical impulses up all the time, and pain should be suppressed on this level. Now, this is the famous gate for Malzac and Wall. And now this gate can be open or can be closed. And there's certain things that open the gate. That means they let the pain message come through, and then you're in pain. And there's other things that close this valve. And the things that open it, one is a trigeminal nerve. Yeah? Any excessive input from the trigeminal nerve through interneurons opens the gate here. Now, many of you will think, well, trigeminal nerve, that's just up here somewhere. Yeah? Now, the latest research on the trigeminals shows that there's interneurons from the trigeminal nerve that go all the way down to the lowest end of the spinal cord, which is at L2. It goes all the way. The trigeminal nerve goes down to here. Yeah? This is heart anatomy now. And the trigeminal nerve has this modifying influence on the wide dynamic range cell. That means it can open the cells. If you have a hot tooth, it can create sciatica, it can create pelvic pain, dysmenorrhea, it can create spastic colon, it can create heart disease, it can create angina. Anything in the body that's connected with pain can be created by this opening the gate for some nociceptive input that's coming from these different places. Very important for you guys, for your dentists. And then it becomes your foremost important job to cool down the neuronal stimulation in the trigeminal area. We can do it in the muscles with trigger point therapy. We can do it with neural therapy. You can do it with good dentistry. If you have filling materials that are irritating to the pulp because they're allergenic, You crank up the input here, and you can send the patient from being a normal person into having a severe painful stage of MS within 3 days. Most of you have heard that. You can create sciatica, low back pain, pelvic pain, and you can uncreate it by putting the right stuff in the mouth and cooling down the pulp. The other one that has a cranking up influence that's more significant than the trigeminal nerve is the autonomic nervous system, the sympathetic portion of the autonomic nervous system. And those of you who have taken the neural therapy workshop, you know any scar in the tooth, any overheated tooth from the drilling, there's a little scar and it creates an input in the sympathetics in the tooth and the pulp that will crank up the gate in the spinal cord and send the patient into having chronic pain complaints. And chronic pain inevitably leads to chronic illness, because pain, when this, let's say you get chronic foot pain from this, then there is a downgoing signal to the painful area that creates vasoconstriction. And vasoconstriction creates degeneration and illness. So you can have liver pain created by this process that creates hepatitis. First is the pain creates vasoconstriction. Vasoconstriction then creates illness in that place. Yeah? So we have a mechanism where we know now how scars and abnormal effects in the autonomic nervous system, on the tooth, in the jawbone. Each bone cell in the jawbone, each cell in the jawbone has a sympathetic nerve that is close to it. There is no single cell in the body that doesn't have a sympathetic nerve in its vicinity, creating a web around the membrane of the nerve. So, and then you have the saving grace, which is this one here. This is a proprioception. Proprioception, stimulated proprioception, closes the gate. What does that mean? Well, physical touch, massage, acupuncture stimulates proprioception. The best stimulation of proprioception is having a normal occlusion and a normal bite. You swallow a couple of thousand times a day, stimulating a barrage of proprioceptive input into the spinal cord on this level. Every time you eat, every time you talk, every time you move your mouth, every time you smile, you stimulate proprioception. And if it is normal, it will stimulate the gate to close and counteract those effects here. And now, here comes a funny thing. If we talk to an acupuncturist or neurotherapist, we say, the bite, that's nothing. Trigeminal nerve, that's nothing. You got to look at the autonomic nervous system, that's everything. You talk to a TMJ guy, these guys, acupuncture, neurotherapists, they're all out to lunch, they're all looking in the wrong compartment. It's a bite, because they're talking about this. And then, of course, you talk to the traditional school medicine guys and highbrow guys. We got to fry the trigeminal ganglion, because that's everything. We fry the ganglion, we can prove that all the TMJ pain is gone. And they're proven to be right, by their articles, by their papers. These guys are proven right by their papers, and the neurotherapists are proven right by their papers. And it's time that we all kind of look at the science of it and say, hey, we're all in the same boat here. We're all looking at different things. And when we have this system, why not use the most intelligent intervention, which is the most elegant one, which is non-invasive, non-costly, and is getting the job done. And usually it's a combination of everything. And the most elegant neural therapy in the mouth is the stuff that Dr. Jochen Gladish is teaching. And I think he's going to be on one more time, and I hope you guys are taking that home, because the technique is as simple as he showed it yesterday. You look where it hurts in the back, you inject it with a few drops of local anesthetic, and you see what happens. And you're closing with this mechanism he's working both on the trigeminal nerve and the autonomic nervous system in the most elegant way possible. And by cooling the input down coming from you, closing the gate, and all kinds of things in the body improve: your elbow pain, your shoulder pain, your back pain, your pelvic pain, and dysfunction in those organs associated with it. You guys, any questions to this? I really want you to understand this. This is simple neurology put in action, applied to our thing, that you can argue in any court. You can read this up in any book, in any textbook on neurology. You have a question?
One of the chronic pain syndromes we run into as a physician is reflex sympathetic dystrophy. I understand from what you're saying that really that's not just applying to a limb, but to any part of our anatomy, including teeth or anywhere in the face.
Now, first of all, reflex sympathetic dystrophy doesn't exist anymore as of last year. It's complex regional pain. So anything in medicine that kind of was so severe, and we saw these devastating cases, and suddenly disappears. and kind of suddenly has a new name, you know that people don't know anything about it. and for me personally, hair loss is reflex sympathetic dystrophy of the scalp. Thyroid dysfunction is reflex sympathetic dystrophy of the thyroid, and everything in my teaching, in neurotherapy teaching, is reflex sympathetic dystrophy. It's a dysfunction of the autonomics leading to impaired membrane transport, blood supply, and so forth, and then creating illness. And so for me, complex regional pain is just a subgroup within that group, and it's the same mechanism, because as Ara will show you some cases, trigeminal neuralgia is not except from that. We can almost treat any case of complex regional pain if it's not at a stage where the sympathetics are completely burned out, which is the late stage of it. In the early stages, it's usually a tooth and a dental intervention combined with scar therapy, with neural therapy, that gets these patients well. Yeah? Sometimes, or quite often, the treatment, the intraoral acupuncture, that I like to refer to as intraoral neural therapy, because you do use injections rather than needles, is a wonderful treatment for RSD, and often enough in the early stages to get the patient completely well with a few drops of local anesthetic, twice a week, once a week, and then at increasing intervals to get these people well. So it behaves in the treatment no different from other things. And of course, at the late stages, you have to do all the things, the clonidine and the drugs and the things to cool down to bring the thing back in balance. Neurontin has emerged as a very good drug. For those of you who are not using it yet, I recommend you give that a look.
Dr. Hushman in Florida, the neurologist that sees probably 60 RSD patients a week. You can't have an RSD without having something wrong with your trigeminal nerve. That's what he says. And I've cured several cases that he's taken out some dead teeth.
But the mechanism is this one, and this will stand firm for the next century. Now, I just want to show you one device that I've talked about for 1,000 years that has been way underappreciated by most of you. It's this infrared laser, 830 nanometers, 100 milliwatts. You put a little saran wrap on the handle. We made this one so that the diode is right here in the tip of the instrument, because we found by sending it through glass rods, the wave loses its coherency and it loses its effect. And so we put saran wrap on it and stick it in the mouth on the painful tooth. When you have a hot tooth after you did some interventions like you had, you always get just from the vibration of the drill, you will get pulpitis in sensitive patients. People that are musically inclined, people that are sensitive electromagnetically, they will get hot teeth without you having done anything wrong, just from the sound of the drill. And that trauma, I found there's a couple of ways. One is you can use a Walkman with a headset and put the headset on here, so the thing that's usually on the ears, on the tooth, and play some nice Mozart or Gregorian chants to your tooth, and it will undo the pulpitis in many cases. So it's a very elegant way of doing that. But the laser is a very good compromise, and you can almost turn down any trigeminal neuralgia by lasering the sphenopalatine ganglion, otic ganglion, the vagus, submandibular ganglion, going inside the mouth on the hot spots, and the trigger points with the laser, and you can laser your pain away with this thing. And it's wonderful for the healing of the cavitation. If you have cavitation surgery, the patient should have 15 minutes of this on the tooth every day after the treatment, 5 days for the first week, then every other day for the next 2 weeks, then once a week, and you get much accelerated complete healing, avoiding many of the problems that we see afterwards. If you cannot inject the patient, like we said before, ideally they should be tested and injected every day afterwards for a week, and then every so often. This is a good compromise. It's $2,000. That's nothing. This comes from Canada. A friend of us makes that. It's the best instrument out on the market. There is the one that comes from Texas. It's also $2,000. It's that kind of battery-driven thing. The diode, unfortunately, is not as good. The results aren't that great. It's a little different wavelength. So this is the thing that we're using. I have about 5 of these. Any patient of mine who gets cavitation surgery gets one of these to take home. I don't bother, because I have out-of-town patients. I can't have them for injection. So I get this with some good instructions. And they have excellent results with it. I don't know how you guys are all living without it. I really don't know how you're getting your patients well to that stage after major dental reconstruction or dental work or cavitation work. I don't know how you've been doing it without having something you can give the patient that they can do at home. You must all kind of have sleepless nights or you know, not answer your phone calls. If you do active dentistry, so that was just my little bit. Ara, do you know? Yeah. Do you know the phone number for the laser? I don't have it. You can call my office. What's his name? Rick. Oh, yeah. 604 47 250 474 3514. His name is Rick. Nice guy. He produces things that cost, you know, the only the medical one that you can buy that's a little bit more. They're not approved by FDA. Yeah, they're approved for vet use in Canada. There's an American one that's also not approved. It's $6,000. Has the same diode in it, the same bells and whistles, but it's $6,000. It looks a little bit more nicer. It's bigger, heavier, harder to carry around. And you pay $4,000 extra. So this is an incredible deal. If you know lasers a little bit, there's not a laser in the world that you can get for that price with that diode in it. Okay, one question, but then we have to.
Are there endpoints for the cranial nerves reflected on the internal oral mucosa?
Oh, absolutely, yes. They're the points that Dr. Gladish is injecting. Yeah, he refers to them as the intraoral acupuncture points. I call the end points of the cranial nerves and the sympathetics. Yeah, sympathetics are not amongst the cranial nerves, but the vagus is. So.
Did you inject DMPF at these points?
Oh, absolutely. Yeah, we do it every day. Yeah. Okay, I want to introduce the next speaker. Next speaker is Dr. Elmajian, Ara Elmajian from Vancouver. I met him many years ago at actually my very first workshop that I gave, and kind of was very shakily kind of presenting my first workshop, trying it out. And Ara has been saving my life several times. I had my bite destroyed once, not 7 years ago, by having a full mouth reconstruction, trying to get rid of what I had in my mouth, and I lost my bite and ended up in severe dysfunction of my brain and facial pain and everything. And so he saved me, like doing that, and that's how we met, and we worked together for the last 7 years. And he's become one of the most advanced dentists in the world, combining the principles of neural therapy, myofascial trigger point therapy, dental orthopedics, a whole orthognathic stuff that's out there. And he's a man who single-handedly really had the idea of the intra-osseous neural therapy, the Stabident procedure, and was doing the first experiments on this procedure. And he's giving us sort of today like an introduction to the issues around it in some cases that hopefully stimulate you to consider doing this procedure. I think any dentist who's not doing this procedure is really missing the boat, because it's fun, it's quick, and it's wonderful what you can prevent in terms of disasters in the mouth with that. So Ara, why don't you come on? Ara is Armenian and shares with me his European heritage, but he comes from a part of Europe that is much more fiery than where I come from. So come on up here.
I should put that thing in. Let's share some art. Nervous system, and when I met a physician that knew a lot about the autonomic nervous system, he
Dietrich, as you all know, has his PhD in the autonomic nervous system. So for selfish reasons, I became his friend, and I showed him some other tricks which I learned. I learned from other great people like Janet Travell. Then, for his selfish reasons, he became my friend. So basically, we're all selfish in a certain way. Even when we were doing gracious work, we're selfish. Okay? There's no way I could sit back here and tell you people modalities that you should learn. I am sure all of you know as much, if not more, than I know. All I could do is give you a key to open up your treasures. I could teach dentists intra-osseous neural therapy in less than 5 minutes. My lecture will be over with. But that's not it. Being a clinician, I could stand up here and give you some of my ideas, the way I look at a patient, and I open up your treasures. You say, after I do this intra-osseous neural therapy, I'm going to add maybe gasoline here. Whatever works with you. Whenever I come to a lecture after all these years, I have literally several thousand hours of continuing ed. I basically learn, get a pearl from someone, and then I add that pearl and the string of pearls I have. That's what I do. And it'll be a joke if I sat here and talk something that Runar Johnson doesn't know, who knows more than I'll ever know about nutrition and other fields. And a lot of you here that I know for years. So all I could do is present to you the way I look at the patient, how I treat, and how I prioritize. Prioritizing is the most essential part of my practice. And the longer I practice, the more I realize prioritizing in the autonomic nervous system is working on the emotional component. When a patient walks in and you sit down and you become an antenna, you receive what they're emitting. That's what I do. And if you spend more time with me, you'll understand how I perceive my patients, because they tell us they are crying for our attention, their autonomic nervous system. And by the way, they don't know themselves what they're telling you before you know, because I think the autonomic nervous system sends out the information, you receive it first as an individual facing the patient, then it comes back to the patient, like from the universe. So almost 90%, if not 99% of the time, when I'm standing in front of a patient, I know what they felt autonomically before they do. And when you get good at that, and you want your patient's confidence before you do neural therapy or heart surgery, when you intercept kindly and tell them what they feel, you don't need hours and hours of introduction and their permission, what you can do. This is very important for all of you, is to receive the signals from your patient and talk back to the patient, be a little rude, gently, that they might sweat, and ask them, where are you now in your head? And as you ask that question, you receive the next signal from them, the autonomic signal. The only way you could do that is if you're clean. That means if you have only good intentions. And to have good intentions, you have to work on yourself, like Dietrich taught us, physician, heal yourself. So today I'll give you a lot of pearls, what I think they're pearls, and then you arrange them, catalog them in your heart and soul, and use them in your practice. I'm a clinician. I work all day long, and I do a lot of procedures that I think they were never done before because I didn't know that someone else did them. For example, many, many years ago, when I learned how to do trigger points with Janet Travell, who taught only to use Novocaine or lidocaine. Same time I was doing homotoxicology, I said, I'm going to try to put some lymphomyosol and Traumeel here. I was really shaking. I did it. Then I did my own little private study, and I realized patients, when I used drainage remedy and the Traumeel, which is, as you all know what it is, I got better results. So I went back to Janet and I said, this is what I'm doing. She says, be careful, my son. I'm not careful. I go with my heart and soul. The reason I'm talking to you this way, because you're intelligent. I'm not going to show you more than 5 minutes of Stabian procedure. I'm going to show you a lot more things, how I think, how I touch my patients, how I inject the needle. I could tell you how I use my tactile skills. And mostly, at your level, you guys are senior doctors, most of you, is to understand your patients and prioritize your treatments. Invading the patient gently, getting the patient's confidence decides the success of your treatment. I'm not saying I'm always good, because I could have a bad day. That means before I start working on my patients, like Vega people say, you have to be, sort of clean before you test. If you are irritated at your whatever that day, and you bring that with you to your patient, you cannot diagnose properly. You jump ahead or you don't listen to your patient. So, for you to understand where I'm coming from, you have to know my background. I love that word, background. A lot of European lecturers utilize it, the background. My background, I come from a family that is very medically oriented. My father was a physician and a dentist. So there you go. When I chose to come to North America as a student, because I never had a country. I was born in Lebanon from Armenian parents because they had no country. I came as a student. When I saw the way dentistry was done in North America, I was very impressed first. When I started studying it, I started losing respect. When I went out to practice, I totally lost respect. To a point that I tell professors at the university now that they should change the dental school to a technical school, because it was very well done the way we are taught, the dynamics, how you prepare a tooth and how you put the rubber dam and cosmetics and all that. But as you all know, dentistry became a different part of, not at all connected to medicine. So my background, looking at my profession, was quite different than my colleagues, because most of them, when they went to dental school, it was, most of them, for economic reasons, because it's a good job, relatively speaking, you make good money. So after I graduated, I was always interested in headaches. This is a part of my background, so you know why I'll show you these things. So literally the first week after graduation, I took my first continuing education course. Then a month later, I hooked up with Danar Corporation, with Niles Guichet. I'm talking to the dentists that know all this stuff. I went through the whole occlusal scheme. Then I said, that's not good enough. I have to learn ortho to do proper TMJ. I did 4 bicuspid extraction courses from Jack Donovan for over 2 years. I took a whole bunch of D's, E's, and like 4s, and used headgear, and I really did a lot of damage, I think. When I saw that, I said, my God. So I got into the functional stuff, which was starting in North America. Then, of course, I took a lot of postgraduate courses in prosthodontics and perio. So the first 10 years after graduation, I spent very few weekends having fun. I just went and learned how to do proper dentistry. Then I realized I have to learn physical medicine, because that's not good enough because we just stopped here. So to learn physical medicine, I hooked up with amazing European practitioners from Eastern Europe because they didn't have the gadgets. They knew how to look at a patient and palpate the patient, like Yanda and Lewitt. And then fortunately, I met Dr. Larry Funt, who is, in my opinion, one of the greatest dentists in North America because he introduced Janet Travell to all of us, and Janet Travell. And throughout the situation, I picked up homotoxicology, naturopathic medicine, neural therapy, on and on we go. So you now basically have a bit of my background, how I look at a patient. And when I look at the patient and I examine the patient and listen to them, I decide, am I going to fortify this person like Mrs. Issels mentioned today? A lot of my cases, because as Dietrich sees them, I get the rejects. I mean, I get I think one of the toughest cases on this continent, and some from Europe. The cases that I get in my office before we do amalgam removals or anything, I don't even think of amalgam removals. We strengthen the patient. I have a full-time physician, osteopath, working with me for over 3 years, actually 3.5 years. So one of the first things we do, we strengthen the immune system of a patient by either utilizing intravenous, combination of intravenous vitamins and minerals, or we work on the psyche. Then we look at the structure, proprioception, and one of the last things we do in our practice, we get rid of the toxicities, the cavitations and the amalgams. And because I find proprioception in my practice takes priority on most except the psychological components. Strengthening the immune system, organizing the milieu, which is very important if you're using Sonum remedies, come way before removing the amalgams. Then comes proprioception. Usually, sometimes, you have to enter the system with the proprioception. You have to give them the height first. So now you understand sort of the background, the way I look at a patient. I evaluate their constitution. I look at the autonomic signs. And I watch them so carefully. I look them right in the eyes. And I monitor the autonomics. So as senior physicians and dentists or dental physicians, that's the biggest pearl I can give you. And that's how you hone your skills to understand and feel your patients. Because not all of us have same skills in doing dentistry or surgery or crown and bridge or whatever. We all have some better, some less skills. Okay. Now, lately, the past year and a half, I decided instead of semi-retiring or skiing all the time and playing my music, I said, I'm going to invest a lot of money to enhance dentistry and set new standards because I got sick and tired of the so-called colleges telling us what to do, what we cannot do. So for the dentists today, I'm going to introduce you the way we diagnose. So we have objective data. So if somebody asks you why you removed this tooth, you have hard evidence utilizing objective data because the institutions like graphs, they like lab results, they like x-rays, on and on and on. So I'm going to start this part of the lecture by showing you the diagnostic procedures, not all of them, but the important ones that we utilize now that we do in our practice. Now, as I mentioned to you, we look at structure, function, biochemistry, electrical organism, and the person's psyche. Okay, could we turn on the slides, please? Any questions so far? Dietrich preceded me with this part of our lecture, the autonomic nervous system. I just want to reiterate the sympathetic. How does this work? Okay. As you probably all know, we tend to forget the anatomy and physiology. The sympathetic innervation of the head and neck comes from the intermediolateral nuclei from T1 to T4, and the parasympathetic innervation comes from the midbrain, and the autonomic ganglia. They travel. The sympathetic travels up the carotid artery and other major arteries and veins and supply the head and neck. If you, from this point on, take out the handout I have for you, we will sort of follow my handout, sort of, because my handout is an overall picture of how I integrate intra-osseous neural therapy with my treatment modalities. So the main point of this whole lecture, Dietrich's and mine, is the autonomic nervous system. How it regulates and prioritizes and creates chaos in our bodies. And the dental component, as we call it, plays probably the second most important role in this whole chaos. If the dentist, when you get a patient like with an x-ray like this, comes to you after a motor vehicle accident and they have head and neck pain, where are you going to start? So we basically have many dramatic cases like this. Most of our cases come to our office with panoramic x-rays, as you see here. This individual is a new patient. He suffers from migraines to pancreatic problems to every abdominal problem you can imagine. His naturopath and physicians are very aware, like you guys are, and right away they send him to me, and together we will be treating, as of next week, this individual. Now, since I have 23 years of background, and I want to take my time and have some objective data, I'm going to show you how we diagnose as dentists, and you can go to home and sleep that nobody is going to bug you. One of the main modalities we use, other than the radiographs and oral exams, what we basically were taught in dentistry, in our practice, we test our patients with a new Vega Expert, which has, as some of you know, I will be asking from now on a lot of times to raise hands so I can modify my lecture accordingly. Most of you, are you all familiar with the Vega systems? Anybody? So how many have this new Expert? Okay, wonderful. So as the people who have used it now or using it realize that a part of this Vega Expert show us, and that you can print it out, the dental foci. And as you work the patient, you start having some ideas where to prioritize. But don't rush. Don't put all your eggs in one basket. This is one modality, has been proven for many years. In Canada, just about every naturopath is familiar with it, and most of them have the Vega to test. So I feel very comfortable in my community talking about the Vega system. And to learn this instrumentation, it takes several lectures, and to get good at it, you have to utilize it. Not let your assistant do all the testing. For example, when we were taking the basic course, and there were a lot of technicians using the Vega, and we were testing each other, because of my cranial background, I noticed that this patient does not need remedies for his prioritizing. It was a vagal entrapment. So what I'm saying to you, as a physician or a dentist, you have to know how to use the machine. Yes, you can have your technician or your assistant learn it too, but in complex cases, you better get in there yourself and test the patient, because you have many more files in your head to be able to say, no, I'm going to use this before that. So do not rely on your auxiliary to use the Vega. And as you all familiar, if you use the terrain assessment, you also could talk to the authorities with more scientific background, and they cannot argue why you did this and why you did that. So I hope the dentists in the crowd start purchasing these apparatus, especially you, all of you. You're all senior dentists, very capable. It's time for you not to do basic restorative dentistry, much of it. It's very important, but if you want to assess these complex cases, these cavitations, the full mouth reconstructions, which materials you're going to do, you better start purchasing and understanding, learning how to use this equipment. One of my latest and favorite toys is regulation thermography. Why? Because with regulation thermography, and I'm not putting a plug for Dan Balin, he's going to lecture on this, I think, either today or tomorrow. It allows me as a neural therapist to expedite where the focus is. Let me give you some examples with the overhead. So could someone help me here, Dietrich? Put the overhead up. How many of you are familiar with the regulation thermography here? Okay. And how many have it in their offices, use it? Okay, in my opinion, it's a fantastic tool to have.
That's what you want?
No, the first, somebody took my overheads. Dietrich.
All right. Overhead? You had his overhead?
They were all here. The overhead.
Did you accidentally pick him up?
Yeah, my thermography stuff.
I thought you left.
Protection plan, I can tell you who did it. That's a friend
I'm sure they're under your... Sorry. Okay, as
I have enough overhead in my own office.
regulation thermography, the reason I utilize it, it shows me quickly where the focus is, number one, which area, because it segments the body to total body with the dental areas, the mamma, the abdomen, lower abdomen, the chest. So it basically links, when you look at the whole chart, the dental corresponding with the rest of the body. It tells us where we have regulation, where we have inflammation, where we have too much regulation, which I'll show you in a minute when we find our overheads, and also where we have rigidity. No, I had them right there. I had them all. No, I have others here, but okay. I guess I'll use. I'll use other ones, but that was not it. So this is when the machine did not work and our baseline was too far down. The accurate ones they disappeared. So anyhow, and I don't know this thermogram, but I'll try to show you some points. For example, the black line here is the baseline. The patient, after you check all the points which are anatomical, you challenge the body. The patient takes the shirt off for 10 minutes, 68 degrees temperature. After 10 minutes, you go over the points. Dan Beeling will go over that tomorrow. I'm not going to spend time on this. And then you check the points again. That first one is the first reading. Second, the red one is the second reading. And then the third one is the third reading. That's why I like this machine. Because after I do the neural therapy, I see where it's regulating, how the hyperregulation got better from hyperregulation to normal, let's say. Let's say this is abnormal, which is not that abnormal. And as you see here, the thermography is divided with the head, the neck area, the upper abdomen, lower abdomen, the teeth, and the mamma. So what we basically look at as dentists, when let's say you have blocked regulation in the anterior segment of the lower jaw, and you look also, let's say, the lower abdomen area, and you see blocked regulation there, and you could see the correspondence. Then you look at the root, at the panoramic X-ray, and you find a whole bunch of root canals there. So you start correlating. Okay, is that getting clearer? Why I utilize. So now you're using thermoregulation, challenging the body, seeing how the body is compensating, and you're looking at your dental radiographs and your dental expertise. So now you are developing a diagnosis.
Ira, use the microphone.
All right. And how this is measured, actually, it works with the visceral cutaneous arc reflex. Like the organs, as Henry Heads, as we saw yesterday, they refer to those points. So that's why I really like this machine. And not only that, the best part is the top part where you, in your busy practice, Dan will show you tomorrow, the dental chart shows you right away which areas are more involved, and the body chart shows you which areas you have to be careful of. And this is the mamma chart, but we didn't take it on this patient. Then you look at the areas which are, you have, see, this is, I can't even move with this. Could you pull this up? Tomorrow, it'll be much clearer. Also, you look at the reaction indices. You see where you have blocked regulation or where you have decent regulation here. So by looking at the graphs and the charts, you see the chaos index and the vitality and so on and so forth. It gives you very quickly an idea of the status of the patient. Which organ, which segment of his jaws. Thank you. What a relief. Ah, that's much better. That's why you're Mr. Cavitation, eh?
That's right.
Anyhow, I find this tool extremely beneficial, and the beauty about it, your auxiliary could do this for you, And you quickly, especially with the indices, correlate the problems in the jaw. And do not forget, I like the Vega Expert a lot. Actually, it's the most standard. Okay? So now we have 2 good objective data printouts with your printer. All right? Now, could we put on the now the intra-osseous neurotherapy procedures. I'll give you a little background, the history. A little over 4 years ago, almost 5 years, I saw the advertisement of this tool, and I said, my God, this can be the answer for me because of the jaw cavitations. Because to be honest with you, I was really not getting, in my practice, my chronic practice, the results with the oral acupuncture points. And yesterday I know why. Because as Dr. Gleditch mentioned, the technique, the acupuncture technique, works at the beginning, at the early stages of the illness. When the illness is chronic, I think you have to provoke more. And I'll show you the areas I inject with the intra-osseous neurotherapy, and I think, I'm guessing now, the periodontal ligament has a huge play in this situation. Why the intra-osseous neurotherapy pushes further. It rocks the system. And I've seen it hundreds of times. I know a lot of you use it. So that's the address if people want, where you can purchase it and what you can do with it. But I'll give you some pearls how I do, what I use it for, and how I use it. Now, in this slide, I show you the different remedies you could use, sound remedies, hear remedies, Pascal remedies, whatever you prefer, and the local anesthetic of your choice. I very rarely use lidocaine, and I'll let Dietrich tell you why. You guys, most of you know why. I mostly use Novocaine, and I prefer using the dental carpule because it's much easier with the system to go back to the hole. As you know, the dentists that have used it, sometimes it's very difficult to go in the retromolar site. This is a drill where you use to go through the cortical plate, where after you anesthetize, and that's the needle, and all dentists know how this looks like. First of all, you anesthetize the area, and this drill is a little larger than 27 gauge, and you notice the area I'm going, but you make sure you don't hit the roots. You physicians that are going to try it, I hope you will ask your dentist to teach you how to use it, because you could cause a lot of damage. I've seen, like a few years ago, some chiropractors tried it and we had some problems. So you better have a panoramic x-ray before you try this. Even dentists have problems at the beginning to get to the point. I'm sure a lot of you agree with me. It's very simple. A lot of times in the back area you could bend the needle, or in the molar areas. These are very old slides. I prefer going through the palate. Take note of this. Palatal injections are very, very easy, and you have less complications from the palate. Okay? Now, as you see in this dry skull, sort of this is the area where you go, but I prefer a little higher, because in also regulation thermography, the points on the skin that reflect the teeth are opposite of where the junction of the gingiva and the enamel meet. So I try now, as I'm learning more and more about neural therapy, I try to get the injection higher. Okay? I think there's a difference where you inject because the autonomics and the way the patient reacts. And this is an area which many years ago I tried on the wisdom teeth side as a diagnostic modality. Now, Let's see where I am, because we're running out of time, as usual. Now, the areas that I use this intra-osseous neural therapy first, historically speaking, I don't like doing root canals, and this is a big pearl. I know a lot of the dentists here are doing it. Whenever I got a hot tooth after crown and bridge procedures or deep restorations, I utilize a drainage remedy, Traumeel, and Novocaine or lidocaine in the area to calm down the tooth. We do the procedure, and my assistants see whenever the blood comes out dark and rushes, you can see the inflammation. Okay? So don't be scared. Do the procedures several times. You could do it like 2 days later. Bring the patient back, assure them that this is good, it's still sore. You do the procedures several times. I've done it up to 8, 10 times. You say, Melanie? So I started using the system for hot teeth first. I didn't dare to use Sonums first and all that. So it started, if dentists in this audience want to start the procedure, make sure you use it on hot teeth so you avoid root canals. Now, it depends on your knowledge of the remedies. You could add on and on and on and on the remedies you want to use. I gave you some samples there. I have a lot more in my office. I use a lot more remedies than you see in the sample here. So you can use your imagination, add and subtract the remedies. So first of all, it works like a charm on hot teeth. If the tooth is crowned and this procedure doesn't work, the next best thing to do, which all dentists that know cranial have missed, remove the crown. When you remove the crown, you let the teeth breathe, flexion, extension. Most of the time, when you remove the crown and you do the neural therapy, 95% of the time, if you are not in the pulp, the tooth recovers. Since I'm a private practitioner, I still do my own research, ongoing research. I hope in a year from now, I'll show you some really neat procedures I'm working on now on traumatized teeth and on cavitations. I'm using some new techniques that I'm working with in my head, and I'm ordering some new needles. Yes?
What do you cover the tooth with after you remove the crown? Because you can't have
Temporary.
Pardon?
Temporary crown. Put back on the temporary crown, looser crown.
Okay.
The metal crowns or tight crowns could impede the motion, the tooth motion. Okay? Now, the most important part for the beginners is to utilize it on hot teeth, drainage remedy, and the remedies of your choice to calm down the tooth. Now, as we continue and your knowledge in homotoxicology increases, or you know more than I do, you're looking at the paraphernalia of remedies. From my myofascial background, when I do trigger points, I've been doing it for many years, actually, over 10 years. I have it on my charts. When people brag about how long they're doing, I ask them, show me that in your chart. What year? 1980? 90? Because now at the university, at the lecture, as you guys all know, when they accept the modality, they say, oh, we're doing it too. They just started last month. Now, when I look at a person and I'm doing the remedies, I use compound remedies, homochords, metabolic remedies, drainage remedies, and symptomatic remedies, right? So if the tooth is hot, you pick the symptomatic remedy and the drainage remedy, the proper one. And then thirdly comes the compound remedy. As we get on to the more difficult cases and more tricky cases, I'll show you why I use the homochords and how I relate the organs with the intra-osseous neural therapy. Just be a little patient. And this slide, actually, in the olden days when I started doing the retromolar areas, because it's so thick, I used up to 4% lido there to shock the system to see if it's going to regulate the heart. As you people know, the wisdom tooth area is related to the heart. And I proved it to my oral surgeon. Unfortunately, they didn't have the electrocardiogram hooked up. In 2 cases, after we got in the site, this is over 2 years ago, the heart regulated when we cleaned up the site. But before we do that, the cavitation, we use intra-osseous neural therapy as a diagnostic method. Before you do any cavitation, just use basic Novocaine or lidocaine, and the patient will get better anywhere between 6 to 16 hours. Then you try it again. These are the patients that are wishy-washy and you haven't connected with them with your autonomics, all right? So don't do a cavitation, don't rush into it. Just test it first with the lidocaine or Novocaine only. Don't use the drainage yet because you're already healing them, taking care of that when you use the remedies, okay? So you could use the intra-osseous neural therapy as a diagnostic method, okay? Now, as you get more sophisticated and you want to use intra-osseous neural therapy and esopathic remedies like the Sonum remedies, which all of us, I heard Dr. Nye a year ago, we're just developing these new beautiful techniques combining these remedies. For example, I will tell you what works best with me because in Canada we didn't have much access to these remedies, so I had to get them from Spain or wherever I can get them from. On tough cases, the real canaries of the society, before I do any of these procedures, oh, you found them. Yeah, well, okay. Doesn't matter. First of all, to strengthen the area, the dental focus area, before you do the cavitations or you don't want to enter the system yet, the patient is weak, my remedy of choice with the drainage remedies and the traumea will be notocheel. Why? Because notocheel strengthens the immune system. So you start off with the notocheel. You could even give them notocheel drops. Let them strengthen. Then you work with the physician or the naturopath. They're working on the milieu. The gut is so important, as most of you know. So we're working on these tough cases like the panoramic I showed you. You don't get in there and do the procedures. You start strengthening the immune system. The dentist starts with the notocheel. The naturopath works on the gut, the bowels, and you strengthen the system. You give them the IVs. All right? Now, I have a physician who is a brilliant physician, Saul Pilar. He's a biochemist and a physician. We use amino acids. We use amazing materials to strengthen and get the patient up. Okay? Now, the other remedies, Sonum remedies that I use, to heal an area, you have to increase circulation. So mucocheel will be the remedy of choice if you want to increase the circulation. Now, if you suspect pelvic problems, the patient has pelvic problems and dental problems, like if it's an anterior area, okay, as I showed you in the thermography, I like to use Nigrosan, because we're talking vibrations here. Energetics and vibrations. You could test it with the Vega Expert, okay? So Nigrosan will be the remedy of choice if it's an anterior, or if it's an infection, arthrochelan A, because it's a bacterial remedy. So it takes time as you play with it, go to the courses, talk to the people who have worked with these, and we're changing, we're evolving. Now, to start draining these remedies, the Sonum remedies, you use their drainage remedies, okay? Like you use citrocheel or sanuvis. If you look at if I look at a patient and he's a dirty looking patient, like you know those patients whose skin is greasy and they come in as if they didn't wash their hairs, I prefer citrocheel over sanuvis, okay? So just use your imagination. Look into your files. Don't look at my notes. Listen to your notes. And if you don't know enough, phone these guys that know more about these procedures, okay? So arthrochelan A works very well when it's a fungal problem. Bacterial problem. Now, if it's a fungal problem, go into the fungal guys, like Pafrocheel, which is a milder form than the albicansas. Okay? Now, if you want to strengthen their immune system, go to the mild ones like Eudelin and Latensine. Okay? Now, since I'm really into the autonomic nervous system, I'll give you the pearl of the Sonams. If a patient is fearful and you have autonomic dysregulation, you want to regulate it, Musidokeel is the remedy of choice because it works on the autonomic nervous system. Musidokeel. Okay? So this is exactly what Klinghardt and we are very, very close friends, and that regulation, that's what we do. We are regulating the system to get the patient out of trouble. Now, after you do the chelation with Klinghardt's technique and you want to use the milder long-term chelation, then you could use the Sonam heavy metal chelators, like pileochelate. And those are very slow, milder form, like a maintenance. You could use that. Okay? Now, in the jaw foci, which we all know we have heavy metals, you could use also DMPS. Okay? My latest, like only a couple days ago, I raised a flap to remove the heavy metal, the tattoos. How can you remove them? They're all embedded in the cell. So we just started, we took a chlorella capsule after I raised the flap, as dentists know. We put Proalgin for 10 minutes in the area, washed it out. First we put DMPS, closed it, waited a few minutes, washed it out, put Proalgin, wash it up, put some DMPS, and then we put chlorella. Okay? Next year I'll tell you what happened. Because we cannot take that huge tattoo of a patient, so I don't know. That might work, that might not work. Okay? We just sprinkled it right on, and it caked on, and then we washed it off.
So they started putting chlorella in the cotton roll that you stick in the mouth, and with that you can very effectively remove amalgam stains in the gum without surgery. 10 minutes twice a day, and it takes only 2 days.
What was that again, Dietrich?
Pardon?
Can you repeat
what he said?
I was not listening to Dietrich. Because I listen to him all the time. I mean, I know what he's talking. What were you saying again?
The thing with putting chlorella in a cotton roll and
Oh, yeah. Yeah, well, you could soak a cotton roll and sprinkle the chlorella on it and just put it in the site. You could teach that to the patient. Yeah, good point. Okay. Okay. I utilize a lot of heel remedies. I think heel remedies and Sonam remedies work very well together. That comes from my homotoxicological background. You wonder, if you look at your page 4, why I have cactus compositum there. That's where I use on the wisdom tooth sites, because cactus compositum is great for coronary circulation. So that's the area, and I don't have much of it. I have it hidden in my drawer. So just use your imagination. Why and what site, what the tooth, which organ it's related to. Use the remedies that vibrate with that organ. You want to test it, you test it with your preferred EAV machine or whatever you use. If you want to be a senior dental physician, just take your time. This is as we are evolving here. Okay? Why I use pulsatilla? Pulsatilla is great for detox, and it stimulates your defense system. I use Sorinoheal a lot, which I didn't mention here. If it's a sinus problem, use euphorbium with the sinus remedies. So we do a lot of sinus work. Do the cavitations, and if you've taken neural therapy courses, we flood the sinuses. We use euphorbium in it and all the other goodies. All right? Now, this is quickly, because I use a dental syringe, this is how I feed my carpule. The dentist will get this very quickly.
I thought I invented that.
Pardon?
I thought I invented that.
We're always inventing the same thing they invented 5,000 years ago, you know that? Everything has been around, actually. We're just using different tools. Okay? That's what I do. And we're going to skip over this because, as usual, I have so much to show you. And we can't see that, and that's what I show you, a case that was root canal, epigoectomy. The patient was going crazy. I extracted the tooth. I've had about 2 or maybe 3 of these cases. See that nerve on the side of the tooth? So you have a live wire and a dead tooth. This woman could not walk. Right, girls? I have to mention that my wonderful staff here, Melanie and Nisa, that really support. Without them, I can't do this. I can't do this. And one of my great associates, Veronica, over there. So I have a huge support in my office. We have, how many people work with us? Yeah. So you can't do this. Like, you need support. And they keep me straight. Sometimes irritate me. Now, this is a cavitation site. They could be huge. Chris is the master of this. And with the gauze, or what do you call the gel foam, you could add the Sonum remedies. You could sprinkle it on, and you know, all these little pearls that you all do probably. You just, with the injection, and I always put the Novocaine in the area. I'll tell you in a minute why we use the local anesthetics, because that question came up. I'll tell you in a minute why it's so important for me to use a local anesthetic. So we use the remedies in the gel foam, and it soaks in, and it promotes healing. You should take the Sonum courses. It's very important. We can't teach you this in 1 or 2 hours. Now, we are getting into why I got better at this, because of trigeminal neuralgia. I think in my office, I feel like everybody in North America that has trigeminal neuralgia found out about me, because I think I have good success with trigeminal neuralgia. Why? Because right here I use this theory. Trigeminal neuralgia has a huge involvement with the jaws, and don't forget the glossopharyngeal nerve, the facial nerve, and the trigeminal nerve. And I'll show you how these modalities work. Number one, this case that I showed you the surgery, he got better. All right, after the surgery. This is, just put the slide quickly because this was an emergency. The patient went to Mexico, was fine for almost a year. The bicuspid abscessed. They phoned me from Mexico during Christmas. I couldn't get to the phone. I phoned the hotel, and they had left, and the whole story goes on and on and on. Come to my office. The patient is coming to my office so I can remove the tooth and do neural therapy, because nobody, wherever they were, could fix it. I didn't know names in the area. In Palm Springs, I don't know anybody in Palm Springs, and in Mexico. So on the way to my office, this tooth is related to the gallbladder, right? He had a huge gallbladder attack. Instead of coming straight to my office, they went to the hospital, and they removed his gallbladder. And if you look at your dental chart, that tooth is related to the gallbladder. So he arrives at my office 2 days like 3 days later with this, okay? Then we take, look at that. We take the tooth out. But now the chaos had started. My theory in the autonomic, all chronic illness, this is maybe other people's theory too, maybe it's Dietrich's theory, I don't know. I think all illness is random chaos of the autonomic nervous system. And this guy got into the chaos. And we had to clean his jaws again, because it was amazing how much more cavitation we found. So because I've done quite a few trigeminal neuralgias, be suspicious of the other side. So use your intra-osseous neural therapy to see when you drill a hole, you push the syringe, it goes poof in a hole. He's got no symptoms on the other side, so you better go in there and provoke the area with the Sonum remedies, and he will be sore. He'll be convinced in no time. But usually trigeminal neuralgia patients, when you stop the pain for a few months, they adore you and they will do anything you want. So this patient last week, we had to put him under general and open his jaws, and we found a lot more cavitations. Now we're getting into the more advanced technologies here. This patient had trigeminal neuralgia, and we stopped it about 2 years ago. She had pneumonia, and she'd taken a lot of antibiotics. The trigeminal neuralgia came back. So what do? Well, look at the thrush on her tongue. And what I used here, the remedies I used to stop the neuralgia, and it took only 3 treatments. I did not use the same remedies I used. Actually, this was one of the first neuralgia cases that I stopped with using Sonum remedies. And to do the solemn in the jaw first time, I was really scared because we had to stop the pain. So I told her, can I do this? She said, yeah, and we were successful. But 2 or 3 years later, she comes back. Now, let's use our intelligence. What do you think, let's have one guess or two guesses, I used as a solemn remedy here? I didn't use the arthrochalain. I didn't use the mucocheel. I used a pefrocheel, and it worked. Okay? So I changed the vibrations. I used a pefrocheel here. All right? And after 3 treatments, she was fine. Okay? Oh, if you look, you could see I do a lot of holes all the way to the front. On the ridge, wherever you can find, no, this isn't ridge. Because this patient is very thin ridge. You have to go down, okay? And the upper. Be patient. It works. You have to do it several times, okay? You can see, you should see how I'm doing it here? Right? Right on the ridge. Then, okay, let me give, now we're getting more and more advanced in this, people that do neural therapy. This is a huge pearl, and I know most of you don't know it, if not all of you don't know it. When you have a facial pain, trigeminal neuralgia, and all these, one of the greatest neural therapies that I have a lot of techniques I sort of invented is segmental therapy, platysma. You can't freeze a patient, do segmental therapy, platysma. Stops the neuralgia. The teeth freezes. The teeth, which doesn't freeze, it's amazing technique. So we're doing regulation therapy. This is a huge pearl for dentists and physicians, actually. Segmental therapy, this area, the neck area, subcutaneous. Okay? Why it works? I think this works more than because it's acute acupuncture. Too bad Dr. Klinghardt is not here. Stop the heat was stopped right here because I did this treatment on this lady. Okay? Segmental therapy, platysma I call it, because it's platysma. And this is with the yeah, you could do both sides, but usually it works on the side that's hurting.
How many quarters?
Oh, as you saw, many quaddles, like all across. I'll show if I can. Then with the same patient, like a whole bunch of them, right? You saw it on the slide. Should I go back? Show you? Yeah. All right.
Laser pointer.
Okay. Oh, sorry, I guess. All over. 1, 2, 3, 4, 5. We have a little, see, all here. Bang, 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 bang. Like, see, up there? And great points are where we have the creases. A lot of disturbances in the creases. Okay? Segmental therapy. It really works. Try it everywhere else in the body. Now, so segmental therapy, intra-osseous neural therapy in the jawbone. So it's not just a pretty word, it should be called no more StabiDent. I get irritated when people, because I'm looking at a better system than a StabiDent anyhow. StabiDent is a vehicle, but it's intra-osseous neural therapy. Okay? And sphenopalatine. You could do the stellate. I do the stellate in some cases. All right? Submandibular. All right? And you could do the otic, whatever. And if you're more progressive, you go to the major acupuncture points. A lot of the patients, you do all these steps, and it's not well yet. There's 10% pain. You go to the meridians, the main meridians. You do the meridian, it's gone. So my girls have seen it so many times. Like it's just like there's a lady. You do all the points. If you don't go do the intestinal point right there, pain doesn't go away. But when you do the dental foci, they're the most powerful. The dental foci, we rule. Dentistry rules. I mean, in neuralgia, the dental points are so important. So start using your imagination. If you're a chiropractor, do another adjustment, which relates to the segment. If you do some other medicine that relates to the organs and the systems, utilize it. This is not, I'm evolving. And as Bob mentioned during the break, you're absolutely right. When you do these procedures, the bugs or the bacteria, whatever you want to call them, they migrate. So you have to chase these guys. When you chase them with the Sonum remedies, you're changing their form. You're making them friendly people, right? That's why we're using the pleomorphic products, to change the environment. We're not killing the pathogenic bugs. We are changing their forms. So that's what we're doing. Okay? Now, with the thermography, there's a section of the psyche of the person too. And also you're looking with the psychology. And if the person has psychological problems, you look at the homochords to combine with the treatment. Okay? The higher vibrations. The compounds, different. The drainage is different. The constitutional remedy is different. Okay? And the more you utilize these, the better you get. Now, this is another. I have some really nice things, but we don't have much time. This lady came back. Suddenly she has toothaches, the front teeth, not a filling in the teeth. Of course, we're not going to do root canal, so we do IO with Traumeel, lymphomyosol, whatever. It doesn't get better. Okay? See, it's a little better. Okay? We did the front teeth. She didn't get better. 50% better. She came back. The second time, I did it again, but the front teeth are related to the urogenital system. From her history, I know she has uterine problems, surgeries there. So I combined with the front teeth, Hormeal, let's say, did the teeth, and segmental therapy. Okay? I do these procedures. We are dental physicians. I tell my patients I've done these procedures for years. When you do quaddles, I know how to do acupuncture, I know how to do these procedures. So when we did the upper front teeth and the segmental, the pain went away. It's gone, finished. Now, same thing, kidney problems. Patient comes in, severe kidney pain, you did everything. The kidney pain didn't go away. Look at the panoramic, nothing wrong with the lower anterior teeth. Do the Solidago, which is a great kidney remedy, the lower anteriors, and kidney segmental. Any dentist could do kidney segmental. I mean, it's just under the skin. So you see how our profession is evolving. We are here to clean up the garbage we created. We did a lot of good in the 50s and 60s. We stopped decay. Now our young patients have no cavities. We're doing nice orthopedics. Now what we have to do, us here, clean up and again become dental physicians like my father and stand up and tell those guys where to go, because I did that last Saturday. See, like if we can't do these procedures, it's your attitude. Why do we go to a university? Why don't we go to a technical school and know how to fill, drill, and bill, basically? So if you're a dental physician, at everybody I look at, it's time to involve. The more of you do this, the better off I am, because I have more strength. Okay? So get involved in these procedures. You will have miraculous cures. I've done hundreds of these cases. Not 10, not 12, not 3 dozen. Hundreds. And I kept it quiet for years. All right. Now, if we have time, this is a great study done by a friend of mine I met many years ago in Japan. I was planning to read from the article, from the main article. This is one of Dr. Kiyoshi Miyahara's students did the study with dogs. And it really goes, how many people have this article that came to neurotherapy courses? I gave it away. Anybody here? This is an amazing, pardon?
This was the one a while back where they took the occlusion.
Yeah, this is 89, like, okay. So it's almost 12:30, so I am not going to go over the whole article because it's very precious. I should have read a lot of the points. See, the Japanese, my friends, I know this guy personally because we shared information how to do my splints and occlusion. They missed the autonomic. They mentioned it, but if they know what we know now and we know what they knew, like once we start combining, it's amazing. So they didn't realize as much that these guys got in the pulp of these teeth, like the dogs. What they had 3 dogs, and they ground down the occlusion on one side, 3 millimeters. So the first thing that goes is the proprioception. The jaw shifted to the right. Okay? Because of the pain sensation and the autonomics, the nociceptive fibers started firing like crazy. These dogs started many autonomic signs like loss of hair. The shine of their hair all changed. And then eventually their hip, the opposing hip torqued. They all had their complete leg torqued in, and they had a limp. All they did was, it's a great study. If people want copies, we have it at the neural therapy seminar. So, and then the teeth had abscessed. They started the drainage here. Could you see? Okay. So they started all the autonomic signs. The eyes changed, the posture changed, and they all developed a limp, right? From occlusive destruction and exposure of the pulp. But in the article, they don't realize how important it is. But neurologically, they track it to the amygdala and how it affects the autonomic nervous system. So anybody that argues with us, we have a great study done in the 80s. And this is a great article. We do not have time to go through it. So us dentists have huge responsibility in proprioception and regulation. And as you see here, how the eyes change and the fistula developed and the pelvis torqued. Wow, the energy that's coming out of you. Phew. So how was that?
Great. Excellent. Great. Fantastic.
Now, let's digest this vibrations that are going from you to me and in my state now. What I would urge you to do, as Vaughn was mentioning yesterday, like I feel, if you saw the lectures come up the last 2 days, including me, you felt the graciousness of Dr. Gleditch. He's so gracious. And Klinghardt is a sweet man. And I think I am in this world to be the warrior. I don't want to be the warrior. So I'll tell you how it feels to confront the establishment. I've been there, and some of you have been there. And this is for our friends who are having problems. I was a little fortunate when I confronted them because I said, okay, I looked at the worst thing that's going to happen to me. And the worst thing that was going to happen to me was I was going to ski and have fun and do research. Really. I was able to do that. So what happened, I confronted these guys, and the best thing happened, I went into their living rooms. I sat on the board table, huge, 12 of them and me, but I took my physician with me that works with me. He's an osteopath and an MD. When I looked at these people's faces and eyes, right in their eyes, as I told you how I feel the autonomics, I said, what do you know about this stuff, to the oral medicine guy? I said, what I do has nothing to do with what you learn about pemphigus vulgaris. And I looked at the endodontist, and I told him, because I know him well, I said, John, the day will come that you're going to remove all your teeth. Is that why you're taking a lot of implant courses these days? Endodontists have study clubs now, implant study clubs, because they know. Don't tell me they don't know. So I was there. So I felt these people. And I said, if this is going to regulate me, I'm not scared of these people. It's your attitude. So I developed an attitude. But don't be too rough with those people. because after I really threatened them, but I knew that they're stronger than me, I gave him an out. The big thing with them about me was, how come I'm injecting up and down? All right? In my fee schedule, I can do acupuncture in my college, okay? So we had an agreement, because these guys don't know anything about anatomy. They don't know. They've forgotten. They've learned it. We said I can inject deep with the remedies to the trapezius. I said, do you know that the trapezius goes way down here? They said, no, 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 no. I said, where to? They said, well, middle trapezius. Okay, we discussed to here. I said, well, what am I going to do with my acupuncture knowledge? Oh, you could do that all the way down, as long as you don't push the plunger. Okay, so then we had another agreement. I said, then I could go to those segments, and I could shout to Greg, and he pushes a plunger. Honest to God. They said, then you could do that. So I go to the segment. Greg is supposed to press the plunger.
He's really busy, though.
Pardon?
Greg's really busy.
So what I'm saying is, like, so this is not a joke, okay? But when you confront these people, you just cannot confront. You have to give them an out, okay? So it's time for us, what we call ourselves biological dentists or dental physicians or whatever, not to be scared or shy about what we do, because I'm sure a lot of you have hundreds of patients that just love you because you save their lives. So don't worry about it. Just do it. And the more of you do it, the better it is for us. Okay? So I'll answer some questions later because we have other people to lecture at lunch. Thank you very much. I turn it off. So.
I'm glad that I'm not lecturing now, because that would be a hard lecture to follow, I'll tell you that. Let's go have some lunch. Lunch is on clean morphic products, the people that sponsor the Sauna Remedy. And right here in Sassy's, you have to have a little yellow
They're here.
ticket.
They're here.
That's a good question.
They're here.
Head back towards the restaurant, and Carol will take care of everything.